Episode 9: Why the Job Market Matters More Than You Think. Welcome to Medicine, Dollars, and Decisions, Life and Business in Medicine. I'm Dr. Bruno Casanova. Today, we'll talk about supply and demand, and why the job market can change the value of your work more than many clinicians realize. In many ways, provider compensation works like the housing market. Let me explain. Imagine a remote town with only one hospital. The town has one family medicine physician. One day, that physician decides to retire. Now the hospital has a problem. If they cannot recruit another physician, the entire community may lose access to primary care. So the hospital starts advertising for a replacement. But because the town is remote, and because fewer physicians may be willing to move there, the hospital may need to offer a higher salary or a higher dollar amount per work RVU than hospitals in larger cities. That is supply and demand. The product, in this case, is your medical service. The demand is the need for patient care. When providers are hard to recruit, compensation often increases. This is why a hospital in a small town in Louisiana may offer more money per work RVU than a practice in New York City, even though New York City may have a higher geographic adjustment index. Why? Because in New York City, there are usually many more providers looking for jobs. The demand of care is high, but the supply of providers is also high. That changes the economics. Let's use a hypothetical OBGYN example. We previously discussed that the national Medicare conversion factor is approximately $33.40 for most clinicians in 2026. We also discussed that New York City has a higher geographic adjustment index, so the effective Medicare work component may be higher than in many other parts of the country. In simple terms, the geographically adjusted work component in New York City may be higher than the national baseline. Now, let's assume a hypothetical average dermatology salary in New York City of approximately $368,000. If the hypothetical national median productivity for a dermatologist is approximately 6,800 work RVUs per year, that salary would equal approximately $54 per work RVU. But here's the disconnect. Let's assume a contract offering approximately $38 to $48 per work RVU. Let's use a hypothetical midpoint of $45 per work RVU. If an employer offers this dermatologist approximately $368,000 and the actual compensation rate is $45 per work RVU, then that physician would need to generate approximately 8,178 work RVUs to justify that salary, not approximately 6,800. And that matters, because approximately 8,178 work RVUs is much closer to the 75th percentile of production in New York City, not the median. In other words, you may be receiving what looks like an average salary, but the production required to support that salary may be closer to the 75th percentile work. That difference must be addressed somehow. It must be met. Either the physician increases productivity by seeing more patients, performing more procedures, or improving efficiency, or the employer reduces margins somewhere else, or the organization absorbs the difference. Of course, this is a simplified hypothetical example. Physician compensation is complex, and many other factors are involved. But the point is important. There can be a difference between what you are paid and the level of production required to justify that compensation. This is essential. This is especially relevant in large cities like New York, where academic centers, prestige, lifestyle, and dense populations attract many providers. That can create salary-heavy contracts with relatively high base salaries but lower marginal productivity payments. In other words, providers may earn more in New York City but may also have to work harder for each additional unit of compensation. Now, let's keep this in perspective. Not everything is about RVUs. Not everything is about productivity. Lifestyle matters. Call schedule matters. Weekends matter. Time with your family matters. A supportive work environment matters. If you're constantly on call, working most weekends, exhausted, away from your loved ones, and practicing in an unhealthy environment, then it may not matter how much you are paid per RVU. Your quality of life may still suffer. Everything has a cost, especially living and working where you want to be. In the next episode, we will look at what all this means for new physicians entering the workforce, and why the highest starting salary is not always the best contract. This episode is for informational and educational purposes only, and does not constitute financial, legal, tax, investment, contract, coding, billing, or medical business advice. Listeners should consult qualified professionals regarding their individual financial, legal, tax, employment, contract, coding, billing, and medical business decisions.